Hi, my name is Evelyn. Today I want to talk about hypertension. What is hypertension? Hypertension is basically elevated blood pressure. So your blood pressure is high in the vessels of the heart. So there's a systolic blood pressure and the diastolic blood pressure. A systolic pressure is the top number where it's a pressure in the artery when the heart is contracting. And the diastolic pressure is the pressure in the artery when the heart is relaxed and filling with blood. So basically during systolic pressure, the heart is contracting, trying to deliver blood from the heart to other parts of the body. So that's when you have that pressure. And the diastole is when the heart is filling with blood so that it's at rest. So the typical guidelines for a blood pressure for a systolic and over diastole, less than 130 over 80, that will be a number. Like it's okay for a blood pressure that has less than 130 and over 80. So that's fine. That's according to CDC and Heart and Stroke Foundation. However, blood pressure varies with people depending on your age, your medical condition. So it's not really specific to that level. But if you're getting higher than 130, you should be following up with your doctor to get yourself checked. And having just one blood pressure reading does not indicate that you have high blood pressure. You need to get yourself checked multiple times in order for you to be diagnosed with hypertension. So it is important that you follow up with your doctor to get yourself checked to make sure that you are taking the appropriate measure to ensure that your blood pressure is in check. So before I dive into different types of blood pressure and stuff, I kind of want to give some key factor about blood pressure, why it's important to check your blood pressure. Do you know that blood pressure is the #1 risk factor for premature death globally, and that approximately 1.3 billion people globally have high blood pressure, and only 46% are aware that they have high blood pressure? High blood pressure is a silent killer, and if left unknown can lead to organ damage such as your kidneys, your heart, your liver, your brain. Elevated blood pressure over time can lead to stroke, and it can also damage your arteries where it become inelastic. They're not able to pump blood effectively, and this can lead to low cardiac output. Low cardiac output can lead to angina or heart attack because you don't have enough blood supply to your heart, and it can also lead to heart failure as well and other type of complication. So it is important that we get our blood pressure in check, following up with your doctor, and the different ways that you can manage your blood pressure. Like you can do lifestyle changes by increasing your physical activities, by not smoking, by intake of your alcohol, how much alcohol that you drink, and also by losing weight if you're gain weight, losing weight, and also basically taking your medication. If you can't change any of those stuff, you can actually take your medication. And I actually did this video because I know a lot of other people who doesn't want to take their medication because they feel that, oh no, I don't need my medication, I'm okay. So if you're not doing lifestyle changes or not doing anything, sometimes lifestyle changes doesn't work for some people, and you just have to take that medication, and taking your medication appropriately as prescribed by your doctor. So it's very important that you follow your doctor's direction and advice. And if it's not working for you, like for example you're taking this medication, it's not working for you, you can always book an appointment to see your doctor and tell her, oh, this is giving side effects, instead of having to stop the medication abruptly, and that can actually also cause other complications. So it's always advisable that you follow up with your doctor. If that medication doesn't work for you, have so many side effects, the doctor, he or she can put you on a different kind of medication that works for you. So I'm going to dive into the medication piece of the blood pressure, how this medication works to reduce the blood pressure. There are 5 medications I'm going to focus on, and the first one is the diuretic, and the second one is the angiotensin converting enzyme inhibitor, ACE inhibitor. The third one is angiotensin 2 receptor blocker. The fourth one is calcium channel blocker, and the fifth one will be the beta blocker. Those are the 5 medications that I'm going to focus on that works to reduce your blood pressure. The first one is the diuretic. The diuretic is the one that makes you pee a lot. Those are the ones that eliminate sodium and water they work actually in the kidney to eliminate salt and water. So that way that gets you to pee a lot, and that by peeing a lot, that will reduce your blood volume, and by reducing your blood volume, that will ultimately reduce your blood pressure. So an example of a diuretic is an hydrochlorothiazide. Hydrochlorothiazide helps to eliminate salt and water out of the kidneys, and by so doing, like I mentioned before, to reduce your blood volume and then ultimately reduce your blood pressure. So with hydrochlorothiazide, one of the side effects about hydrochlorothiazide is that they eliminate potassium. Potassium is very important for the body because it's good for contractility, it's good for the heart, helps the heart to contract. So when you don't have enough potassium in your body, you can end up with some cardiac arrhythmia. So it's important that potassium is in your body. So in that way, there's another diuretic called spironolactone. Spironolactone is a diuretic that helps to spare potassium into the cell, the keeping potassium. By so doing, so sometimes doctors might end up putting you on these two same medication, the hydrochlorothiazide and spironolactone, because one of them is sparing potassium, one of them is eliminating potassium. So it just kind of work as a balance. The second one is angiotensin converting enzyme inhibitor. We all know that angiotensin 2 is a vasoconstriction. A vasoconstriction means that it's going to spike your blood pressure up. So when you have an ACE inhibitor, angiotensin converting enzyme inhibitor, they prevent angiotensin 2 from doing what it's supposed to do. In that way, they vasodilate. So while they're vasodilating, that will reduce your blood pressure because it's going to cause the heart, it's going to cause the blood pressure to reduce, in the sense that they are vasodilator. The inhibitors are vasodilator. And examples of this medication are the enalapril, captopril, lisinopril. Those are the different medications that fall under angiotensin converting enzyme inhibitor that also work in the kidney. The third one is the angiotensin 2 receptor blocker. So the same idea as the angiotensin converting enzyme inhibitor, but in this case, this is going to be as a receptor. So they block angiotensin from binding into the cell, and that way we know angiotensin is a vasoconstrictor, like I mentioned before. So this would prevent the action of the angiotensin 2, which will cause vasodilation, and by causing vasodilation, that will reduce your blood pressure. And also another thing that it does is that angiotensin 2 has a property for retaining sodium, salt, and water. So by angiotensin 2 not binding to the receptor, what that does is that it eliminates salt and water. And by eliminating salt and water, the blood volume is less, your blood pressure is less. An example of medications for angiotensin 2 receptor blockers are the T-and-10, the irbesartan, the losartan, the valsartan, the cadesartan. Those are the examples of medications that work on that. These medications can also work for treating heart failure because they eliminate salt and water. So they are also in the heart as well. So angiotensin 2 receptor blockers are in the kidneys, and their receptors are in the kidneys, and they are also in the heart as well. So they can be used to treat heart failure, and also used to treat blood pressure as well. The fourth one is the calcium channel blocker, which means they're blocking calcium from getting into the cell. This type of channel, it's located in the heart. It's found in the heart. So we know that calcium, when calcium goes into the cell, it's going to contract the muscles of the heart. So when you're eliminating calcium from going into the cell, what you're actually doing is that you're relaxing the muscle. So what this is doing is that it's reducing the workload of the heart. So by reducing the workload of the heart, it gets the blood pressure down. So that's all this is doing. So calcium is blocking channels, calcium from going into the cell by reducing the workload of the heart. Because if calcium is not in the cell, there's no contraction. And if there's no contraction, the muscle is going to relax. And if the muscle is going to relax, the workload of the heart is going to be less. And that will reduce the blood pressure. It also reduces a heart rate as well. So the last one is the beta blocker, which is my favorite because I like the name. The names of those medications always end up with LOL, laughing out loud. I always say that. But these are medications that actually the beta blockers. They are blocking an hormone called epinephrine, adrenaline, from getting into the cell. We all know that epinephrine is a contractility, its effect. So when you're blocking epinephrine from getting into the cell, what you're doing is that you're getting the muscles to relax. So when the muscles are relaxed, then the workload of the heart is relaxed, just the same way as the calcium channel blocker. So the muscles are relaxed, then your blood pressure is going to reduce. So when you reduce the activities of the epinephrine, you're reducing the workload of the heart. It's by not allowing epinephrine to go into the cell, you are actually relaxing the muscles. By relaxing the muscles, you are reducing the blood pressure because you're reducing the workload of the heart. An example of this medication is the metoprolol, the bisoprolol, the atenolol, the LOL medications. This medication works in the heart to get your blood pressure in check. This medication can also work in the to reduce your heart rate as well, because as you're reducing the workload of the heart, you're also reducing the heart rate. That's what that does. So these medications are very important. They're very imperative. So if you cannot change your lifestyle doesn't work for you, medication is appropriate, and there's nothing wrong with taking medications if to get your blood pressure in check. Like I mentioned before, hypertension is a silent killer. If left alone over time, can lead to organ damage, kidney damage, heart damage, brain damage, and other complications, and it can ultimately lead to death. So it is important that we take care of our body. Make sure you get yourself in check. Check your blood pressure regularly. Doesn't hurt. Go get a blood pressure machine. Check it. Doesn't hurt to check your blood pressure. That's all I wanted to say. And then take your medication. Take your medication seriously. It's very important. If that's gonna keep you alive, yeah, take it, because you can end up with a stroke as well. There's too much pressure in the vessels. It can blow up the blood vessels, and that can lead to stroke. So it is important that we get our blood pressure in check. It's very important. Get yourself in check.